Welcome to the Mindset Matters, the podcast where psychiatry, medicine, and real human experiences collide, all through the eyes of two psychiatric PA. We're your hosts, PA Mercedes Dodge and PA Jessica Spissinger, two passionate psych PAs on a mission to bridge the gap in mental health care. Whether you're a provider just here to level up your psychiatric insight, increase your mental health skills, you're in the right place. Each episode, we shine a light on the incredible work PAs are doing in psychiatry and beyond. Our goal is to build a community focused on better patient care, professional growth, and personal well-being. This podcast, a little disclaimer, is for educational purposes only. We're not here offering medical advice, psychiatric advice. If you or someone you know needs support, please reach out to a licensed mental health professional. All right, let's dive in.
I found you guys because of the conference.
Really?
Yeah. Instagram and a little bit. Fine.
Well, yeah, I mean, basically we started because we wanted to highlight PAs like you because we are kind of the underdogs. And so we're here in Victoria and we're so excited about talking about how you found psychiatry because that wasn't your primary position after PA school. So how did that transition happen?
Yeah, I have always been interested in it. I think before I knew what it was, I was drawn to it. I enjoyed learning about it in high school and college. I was lucky enough in PA school to have a rotation in psychiatry.
Oh,
Yeah,
not
not
PA schools do it.
Right.
Mine did not.
Pediatrics and psychiatry were the two that I really enjoyed. So then my first job out of school, I was in outpatient pediatrics. I was ready to transition after that role and was lucky enough to find a psychiatrist who was willing to work together to practice.
Find a psychiatrist.
An interview.
Yes, putting your dog out. I didn't get somebody to consider you as an advocate.
Lucky enough with that, I didn't have to self-advocate too much because she had worked with PAs in the past.
That helps.
Yeah. Started with her and was at that practice for 4 years.
This is all in New Jersey,
She's
right?
based in Maryland.
Oh, Maryland. So she had a psychiatric PA before.
Yes.
And she had a positive experience when she sought for having another person on board. Was it broad-based?
Broad-based. When I joined the practice, there was another PA and 2 nurse practitioners.
Is that the practice that got you into TMS or how are you exposed to that?
Yeah. So when I first started at that practice, we were not utilizing Spravato or TMS, but did over time. And that was how I ended up getting exposure to it because I was in a remote position. She was doing it in Maryland. So I wasn't in person.
I'm really interested in that first psychiatric job. Tell me how that built your passion and how you moved on to your next job.
What helped me stay in that field was the providers I was working with. Truly. The psychiatrist, since it was a fully remote position, I started with them in 2021.
Then COVID.
At the time, she was starting to offer for patients to come back to her practice in person. Patients were really enjoying flexibility of being able to join on their lunch break. If they had families, they didn't have to drive
Half an hour in the room for 20 minutes.
So all is to say, I wasn't really sure of the expectation when I was joining. So I worked with her in person, but we were seeing patients remotely together. And we did that for 3 months.
Can you explain a bit more how you guys would make that work?
Yeah. She would join the call with the patient and introduce me. And then I would see that patient the next week myself. So it was a nice way to get to know the patient comfortably.
So it was like a handoff.
Exactly.
Which is the best practice because with work that I've done at collaboration where we're trying to get the patient into the counselor therapy, the best bet is if the initial provider introduces. So it was a good practice because they probably kept the appointments because they knew that the physician trusted you.
Exactly. Yes. And I worked with another psychiatric PA. Shout out Carol Spence. She was amazing. She had been in the psych space a few years before me. She was pivotal in me feeling comfortable practicing in psych and making that transition from pediatrics to psych.
That's wonderful. How did you connect with Carol Smith? Sometimes it's serendipitous. Sometimes it's like stalking. So what did you do?
I got so lucky because she was working at the practice. The practice had a rotation with my PA school.
Where was your PA school?
I went to Peculum in Philly.
Mm-hmm. Yeah, I think a lot of practices that are trying to expand should consider doing preceptorship with PA programs. programs. It's a great way to get to know what kind of PAs are in the area that want to stay locally.
And I'd be so curious to talk to you guys more about how you incorporate that into your practices for psych PAs in general.
Can you tell us a bit more about what kind of trainings you've gone to reinforce your knowledge? Do you have favorite books or conferences or resources?
Yeah.
You're speaking a little bit on this when you walked in, so please tell us more.
As far as books go, big podcast girl. David Pewter
Loved it.
can get your CMEs there too. So those were definitely two that I utilize daily, weekly.
I think the podcast that Peter does is very genuine and you get to know him as the person, not just the clinician. I think that's one of the things that inspired us. We love what we learned about our psych PAs we interview that have really cool hobbies and integrate full health in their life. Big theme, every interview. So let's just jump into that. How do you take care of yourself and what are things that like inspire you? Do you talk to your patients about the things that inspire you?
You have two great questions. Let's start with
What you do for fun.
I think anyone who works in healthcare, especially in psychiatry and the mental health space, there has to be conversations around.
Yes.
and they want to know a little bit about you, right, as a person.
Of course, that's how you build trust. It's how you build rapport with them. For me, so I have a dance background.
You dance with your patients.
I do.
It's a little salsa when they need it, you know.
What's the demonstration? Actually, dance therapy programs.
I'm feeling somatic therapist. When I was working telemedicine, I would tell patients, take your call and go for a walk while we're on the visit. If you need to get outside, do it.
We were talking about that yesterday too. Like some therapists will do walking therapy.
Mhm.
Wonderful.
But in college, minored in dance and chemistry. All the styles are very exciting to me. When I'm talking to patients, it's more about just how do you move your body in any way, right? It doesn't have to be exactly 20 minutes of exercise. So we're doing a week, right? But
Workout clothes.
trying to have that conversation with them about making it fun.
Exactly. And I think that's what dancing is. Once you get very advanced and professional, you have to practice and practice, which really breaks through a different habit in your brain. But if you're just trying to enjoy your body, feel grounded, dancing is one of those wonderful things that no one can take away from you.
Totally.
How
Yeah.
often do you dance?
So now there's a studio by where I live in Hoboken that does adult dance classes once, twice a week.
What does your working schedule look like now?
I just started with practice. Being remote for 4 years was fantastic. There was a lot of flexibility to that. But being single, living alone, I was ready to get out into the workforce. The job that I'm now working at does Spravato and TMS. And they wanted someone on site. I started that about a month ago.
And did that require a relocation?
No, so
Or are you working from home?
exactly. I was licensed in Maryland, working remote. Then I accepted this position in New York. I was able to make that transition. My license,
The positions in the city? Or are you a bridge or a tunnel person?
I go to Chelsea and Brooklyn.
Brooklyn's like a bus, subway, and Chelsea.
I've gotten good at public transit because I've used to.
Yeah. What do you love about your job today? Not the commute.
There's a lot of observation.
I guess the commute, as someone who's an extrovert and loves people watching, I like it more than I thought I was going to. The providers I've newly connected with at the practice are fantastic. There's been an amazing psych nurse practitioner who has shown me some resources, and I've gone to farm dinners with him, PAs at the practice. Brilliant, welcoming. So far,
I think the most fun part finding people that are your tribe in your work, because work is so long hours. There's great stories with patients when they're successful and they're doing better, but there's a lot of stories of trauma and sadness. So if you have a tribe that feels the same values, it's good. We have a mission here. It just feels so connected. Like you look forward to going to work.
I'm doing a 4-day work week, which I started at my last. I was doing 4 10-hour shifts. So now it's fun because I do 2 10-hour shifts on Monday and Tuesday. Wednesdays are off. And then I do a 12-hour shift Thursday, 8-hour shift Friday.
Sometimes it's nice to be so immersed in whatever you're doing. If you're having your day home by yourself, you're immersed in your day home. If you're working, you're just immersed in your work. I know I can struggle like being so focused on my job, but then have to switch gears, go home, transition over to the mom thing, working on campus.
Do you do remote work too?
I do. I see patients both remotely and in the office. And then I do PA education, which is also both remote and in the office.
So we talk about mentorship because a lot of PAs that transition to psychiatry or want to build more skills is looking for opportunities to listen. MGH has a certificate program for advanced PAs that want more psychiatry. And then
There's my 6 baby.
And this is why it's important that we all connect. The amazing thing about this conference, as far as professional experience goes outside of the clinical work, this is the second conference I've been to. And
as a PA,
Was it ADHD or one of the big ones?
yes, it was actually in Orlando. And, but it's okay. I went with the psychiatrist I was working with and 3 other providers. To be honest, I don't even remember the name because it wasn't a psych congress. But then this being the second one has been such a joy and a treat because
Well, your second one is the first one that they've ever had like this.
when they said yesterday, how many psych PAs have you ever been in the room with?
I love that.
That's
I
a
love
great
that.
place.
Yeah. Like I said, because of the psych conferences that happen over the year. What I've always loved about psych congress is that it's interdisciplinary. I also love having something just for PAs.
Because there's so many stories and everyone has different background. Telemedicine or telepsych, like for me, you outpatient and telemedicine. Everyone is different and learning new things and still keep their interests before PA school or psychiatry and integrate into their life.
Which is what we're our patients about, right?
What excites you and sometimes that's involved. Are you directly managing that or is it kind of
Adjacent to, I work with 4 psychiatrists. They're the ones working directly with those patients. My role is doing the 40-minute check with the Spravato patients and touching base with them while they're undergoing their treatments.
okay? And have you seen pretty good outcomes overall?
Yeah.
In both modalities?
4 weeks in, getting my feet wet, but
I'm interested to see where things continue to develop with ketamine, psychedelic treatments, and TMS. What would you recommend?
if they're lucky enough to have a rotation, networking, deciding that they want to do that and being passionate about that, and then connecting with any providers in that space, getting your foot in the door with a nurse practitioner who's been working in psych, getting your foot in the door with a PA who has experience. It's really about making one connection in that space.
My first mentor as a PA was an NP too, and she was just like a boss. She'd been in that field for years. She knew her stuff inside and out. I really developed so much respect. We're kind of all the same, different paths, the same destination. We all wind up in front of the patients. It's like we're all just there for the same reason. I do think what you said about being so lucky to work with Carol Smith should be considered part of the picture when you're applying for a position, right? Like really clarifying, like, what is my mentorship going to look like? What
That's
are the
exactly.
directions?
And I guess to answer that, great question to have. What is your experience working with other PA? And he was at practice, right?
What is the transition? What does shadowing look like? What are my resources for patient consultation?
And I think new PAs or PAs going into new practice need to ask the question and advocate. Because a lot of my positions never had mentorship or shadowing. So I've had to set it up for my needs. And when finding a new job, don't expect it to be already completed for you. You'd rather have it streamlined and designed for your success. And it's the best question to ask when you're transitioning.
As a new grad, trust yourself. Trust your skills. Trust that you're going to be able to get into whatever critical situation and figure it out. You will. All new grads, you're going to feel nervous.
Getting through that syndrome. Trusting your medical training and trusting that you are well knowledgeable and that you could do that job. Never lose that power. When you're finding a job and they don't have mentorship or training, that could be an orange flag that they need your help.
One more question before we wrap up. I want to know, is there any particular areas in psychiatry that really fascinate you or interest you down the road?
Yes. So the 3 that come to mind, ADHD, anxiety, women's health. In the mental health space, I really love working with women, whether it's helping them navigate their menstrual cycles and how they feel throughout the month, or pregnancy planning, period, postpartum.
One of my students for their graduation did a capstone.
Okay.
And she came up with one which was kind of misdiagnosis of bipolar in the setting of PMDD. I was like, yes, much further investigation.
I find that in working with women, there is so much validation that is very helpful for them to understand their own
well, the diagnosis can be the treatment.
I think women's mental health, we definitely need more conversations to be had because they get gaslit for a lot of their medical conditions. This is not just medical, this is psychiatric. So
Physical pain brings them to certain spaces and
Trauma and somatic.
lots to dig into. If there is a PA student that wants to follow you, Instagram is the best way.
it's Victoria, but people close to me call me yeah.
For Starner, TORSTARNER. And you're on LinkedIn like many of us. Thank you so much for being here and chatting. Thank you so much.